I'm Kalie Morsch, and I'm a student at Carson-Newman University in the nursing program. I did my clinicals at Fort Loudoun Medical Center in the North City, Tennessee, and I followed Christy, the house supervisor for the hospital, on day shift. So I did my project on staffing and the relationship with patient falls. Patient falls is a huge deal for me for several reasons. I uploaded a picture, which I know some of you guys have already commented on, of the poster board that I've done, because I know that it's kind of hard to see in this video, so I went ahead and just uploaded a picture in hopes that you guys could see it a little bit better. But one of the main reasons that falls is such a big deal for me is because this picture that you see in the middle of the poster board, that's actually my grandmother's arm after suffering a fall in an assisted living facility. She had called for the nurse 3 different times and never got a response, and so ultimately she tried to get up to the bathroom herself, and that was the result. So, you know, that's not just a little cut or tear, you know, that's pretty significant injury. So this is what we kind of want to try and prevent. The second reason that I really wanted to do my project on patient falls was because when I was at Fort Loudoun, I did 4 12-hour shifts with them for my clinicals, and on average, their patient to staffing ratio looked like this, which is they had it on average about 29 patients. Keep in mind, this is a very, very small hospital. They only have 1 med-surg floor, and I think the maximum number, they even still have semi-private rooms, so they have 2 patients per room. So it's very small. So on average, they had 29 patients with 4 registered nurses, and that includes the charge nurse in that 4. And then they had 2 CNAs. Sometimes they only had 1, but on a good day they had 2. So that means that 1 RN would have 8 patients, the other 3 would have 7, and then 1 CNA would be responsible for 15 patients, and then 1 CNA would be responsible for 14 patients. I'm sure all of you guys have worked in nursing already, or if you haven't, you probably realize that with the way things are nowadays, this is actually pretty common, and that might actually even be better than some patient to staff ratios that you guys have seen. But that's too many. That's still just way too many. It's not safe, and it's not effective, and it's not allowing us to provide good quality care to our patients. And so this is why I'm a very, very strong advocate for patient falls. While I was at Fort Loudoun, they had a patient fall, and I put on my board, you guys probably can't see it in this video, but I put it on the board, like, you know, the patient was wearing a fall risk bracelet. The patient had their posy, which I don't know if you guys have seen those yet. They're kind of a newer device, the posy alarm systems. It's a bed and chair alarm that can kind of be transferred back and forth depending on if the patient's in the bed or the chair. But they had their alarm on, they had their fall proof socks on, they had their fall risk sign on the door and everything. So all of those things were in place. All of those things that have been taught to us early on for, you know, keeping patients safe from falls, those were all being implemented for this patient. The one thing that was not being implemented was a safe patient to staff ratio. The nurse that had this patient was taking care of 8 patients. The CNA was taking care of that 15 on that hall. And so that just goes to show that no matter what you do, you know, to provide other safe measures, that having a safe patient to staff ratio is still very, very important. We get caught up in rooms, and sometimes, you know, it's just unfortunately it still may happen, but if we can get the patient to staff ratios at a much safer number, then hopefully we can prevent the number of falls that are happening. So that's the reason why I chose to do my project on this. So ultimately, this led to my PICO question, which was high falls risk patients on a medical surgical floor will be less likely to fall with less patients per nurse during a shift. We have the Morsch fall scale, we have our bed alarms and everything, but I really just feel like that patient to staffing ratios is key in helping the numbers drop for our falls in our hospitals, inpatient facilities, and in nursing homes and assisted living facilities as well. Some common facts that were kind of eye-opening to me is that falls are the most frequently reported incident in adult inpatient units. The rate is about 1.7 to 25 falls per 1,000 patient days, depending on kind of which unit it is. Some units have more falls than others, and that definitely would play into this as well. But it's a huge thing that we're seeing, and I don't know if it's that nurses are getting kind of lax with implementing these falls interventions, or if it's just the staffing to patient ratios are just really not safe at this time. There's 3 different categories of falls. So you can have an accidental fall, which is like from like an environmental type fall or extrinsic factors. There's anticipated physiological falls. So those are things derived from like intrinsic psychological factors or physiological factors. So if a patient coming onto your floor has Alzheimer's and dementia, or they're confused, you automatically know that they're going to be at risk for falls. And then they also have a category for unanticipated physiologic falls from unexpected intrinsic events. So if a patient is doing perfectly fine and they get up and they have their blood pressure drops and they fall, that would be related to an unexpected event. So those are just some different types of falls that we can anticipate or not anticipate, and those all would go into your assessment and deciding on whether or not initially when the patient comes onto the floor if they would be a falls risk or not. So there's different things that play into patient falls. Obviously their age is a huge one. Physiologic conditions, if you know that they have orthostatic hypotension, then they're going to be at an increased risk for falls. If you know that they have dementia, they're going to be at increased risk for falls. So those are kind of the ones that we pay extra close attention to. We put them close to the nurse's station, we do all the things. But I really want to raise awareness on those that don't necessarily receive as much attention. The ones that come into the hospital, they're young, they're for the most part pretty healthy. They're able, we call them walkie-talkies all the time. They can get up on their own, go to the bathroom on their own, but there's a lot of things that are in the hospital setting that they're not used to having at home, that we still have to take into consideration. This being IV poles. Some people are hooked up to blood pressure cuffs and vital signs machines continuously if they're on a drip or whatever the condition may be, and they might forget about that. So just cords, good grief, there's cords all over the place in there. And bedside tables, people can trip on that kind of stuff very easily. So we just have to kind of keep that into consideration. And that definitely plays into your Morse Falls risk assessment and your scoring there. But basically, I just want to get you guys to know, to realize that this is still a huge issue, and I think that, or I feel personally that this is kind of being swept under the rug a little bit, and it's just kind of being excused as something that happens, and that, you know, no matter what we do, it's still going to happen, which somewhat is true. You know, we can't prevent everything from happening. There's always going to be accidents, there's always going to be situations. But I feel like it's important for us to stop saying, well, it's inevitable that people are going to fall. You know, staffing is huge, and I don't know about you guys, but I would hope that most of us nurses are going into this to try and do everything we can to keep patients safe, and you know, to really do everything we can to work them and nurse them back to health. And a fall can be detrimental to many people's healing and their outcomes. So at some point, I feel like we have to stop and say enough is enough, and we can't take any more people. You know, it's nurses want to fix everything, and we want to take care of as many people as we can and help as many people as we can. But at some point, enough is enough, and we have to say this is just too much, and we have to look at what is the best thing for our patients. And so I would really like to see further studies done on staffing and patient falls, and I would like to implement how different units like med-surg, critical care, ER, all the different things that are being implemented in those facilities, all the factors that play into those units that we see most common, and see what interventions we can do along with patient staffing, lowering that patient to staff ratio, and see if we can get those numbers down a little bit, because I think it would make a huge difference. I think a lot of our patients would recover a lot quicker, and I think that we could really make a huge change if we stuck to what the textbook definition of a good staffing to patient ratio is. So again, I just want to say thank you for all your guys' comments on the poster board already. I know I'm late putting this video up. This has been a crazy semester for, I'm sure, everybody. I'm recording this in my son's playroom, so just kind of stick with me for that. But anyway, so just thanks again, you guys, for hanging with me today and listening to this presentation, and I hope that maybe we can raise some more awareness from all of this and just work towards really keeping our patients safe. Thank you.